Hello, my name is Angela Barnett, and I'm here to give you my $1 million speech. And I have an audience with me today.
Hi.
All right, so how would I spend my $1 million? If I had $1 million to spend, there's lots of ways you could spend it. I thought of writing books, traveling, learning about the world. But I think being a nurse and being so interested in helping others, what interests me the most is something that I've been wanting to do for a while, and that is to become a healing touch practitioner. So if I had $1 million, I would become certified as a healing touch practitioner and I would open a center near St. Cloud, Minnesota. So the first thing you might ask is, what is healing touch? It is a type of therapy, a type of energy therapy. It's also referred to sometimes as therapeutic touch. So there's this electromagnetic field around our human bodies, or energy field. And what the practitioner does is they use their hands to kind of manipulate that field. It's not really a hands-on touching therapy. It's there you hover your hands over the person's body that is receiving the treatment. You kind of use your hands to manipulate that energy field, move things around a bit, and it opens up, it moves around and balances, clears defects, helps the energy flow more freely around the body. Dolores Krieger is a PhD RN at New York University, and she kind of describes it as, she says, therapeutic touch is a contemporary interpretation of several ancient healing practices in which a practitioner consciously directs the energies around the human body. So it's been used in inpatient facilities such as cancer centers. It's been used for treatments for certain immune diseases. It's been used to treat stress. It's been used in psychology and psychotherapy, post-op recovery, and pain relief. Patients usually report a decrease in pain and a decrease in symptoms and relief of symptoms, and increased balance and harmony and peacefulness in the body. This type of therapy is meant to augment or use in addition to modern Western medicine. It's not meant to replace medicine that we have today, but to use in addition to it to offer comfort and relief. There's a website called www.healingtouchprogram.com. It's a nice resource for learning about this type of therapy. I looked up where practitioners are located. You can find a practitioner anywhere in the world on this website. Most of them are in the United States, and of those in the United States, most of them are in Colorado and California. We have some practitioners in Minnesota, but most of them are near the Twin Cities or south of the Twin Cities. So I feel that we have a need in the northern part of the state. And being that I live near St. Cloud, Minnesota, that would be my choice of where to open a healing touch center. So what would I do with my money? I would first become certified. It takes a few months. It's less than 6 months to become completely certified in the course. And then I would use that $1 million to establish this center, open it up, start training other practitioners so that they can learn and spread the therapy around the area. We would offer services to hospitals in the area and the community in general. It would be a nonprofit organization. We're not there to make money, but to help people. So the $1 million would really give this a really nice start and get it off on a good balanced foot. So I think it would be a wonderful benefit to offer to the community. It's a holistic approach, meaning it addresses the whole body, mind, and spirit. So in summary, what I would do with my $1 million is I would use it to get certified as a healing touch practitioner. I would open a center near St. Cloud, Minnesota, and train other practitioners and offer the services to the community. Robert Jacobs is an MD in London, England, who says that the medicine of the future will be energy medicine, and chemical medicine will just be a subset of medicine. He says 80% of medicine will be chemical, will be energy medicine, and the other 20% chemical medicine. I don't know how accurate that will be. That's a pretty big extreme from what we're at now, but it gives you something to think about.